Alright, so in this video I'm going to discuss the other provincial benefits chart. Again, you won't have access to this at the time of this recording, but just know that this information will come available. And again, don't be frustrated with me that I made you work through all of this independently, and now I'm providing you with the completed chart. Like I said in the previous video, there definitely is some value in you working through these websites, having a look to see just how complicated they can be. And I know for certain when you were working through this particular chart, some of the web links didn't take you exactly to where you would want to be, and sometimes there was some additional searching, super sleuthing that would need to go on to find some of the information, and maybe you didn't even find all of the information that I had populated here, or that I do have populated here. Again, I have, a lot of practice experience. I know the information that I'm looking for, and I appreciate that it can be quite challenging for some folks if you haven't had any experience with Alberta Aids to Daily Living, if you've never really thought about what the Alberta Healthcare Insurance Plan means or what it covers. So what I've created here for you really does simplify what we have access to. Again, it's not an all-inclusive list of the provincial health benefits that we do have access to as being residents of Alberta, but it does capture a lot of what we do have access to and certain things that you would commonly come across while you're practicing in community pharmacy. Once you got into this Alberta Aids to Daily Living website, it gets extremely complicated as to where you're going to find information and how to access the information. If anyone practices in community pharmacy where you are an Alberta Aids to Daily Living vendor, you would have a lot of experience navigating through this. It really is something that requires dedication. It has to be quite specific. You have to be deemed as an authorized vendor in order to provide this type of benefit to your patients. It really is something that is managed by an individual or a handful of individuals, because it is quite complicated, and there's a lot of information available and accessible. So it is a cost share program. Typically our patients are paying 25% for the cost of the benefits. There are maximums that are in place. The calendar year typically goes from July 1st to the end of June. That is how most government plans operate. The end of the year for those particular plans typically is June 30th. And then all the benefits reset at the beginning of July, and then those plan maximums will reset. There are some exceptions that do apply. Some senior citizens that fall under the senior citizen category, sometimes these maximums or these percentage copays don't apply to them. It is income-based as far as the eligibility for patients. We don't determine who is eligible at the community store level. There's a whole application process that has to go on. There is a searchable benefit list. It does get pretty complicated. You need to be looking at the benefit lists specific to the type of benefit that you're looking for. So there's a bathing equipment list, there's a prosthetics list, so on and so forth. Again, it does get quite complicated when you start looking at the Alberta Aids to Daily Living website. I've just kind of extrapolated the pricing and fee caps. On the other side, it is identical to the information that was placed over here. It doesn't really define in here who is eligible. What I should have added in this box is it's usually for low income, and it is based on your income, your annual income, and there's additional information that needs to be provided within the application as far as your income tax and so on and so forth. Now, when it comes to the Alberta Healthcare Insurance Plan, as long as you're an Alberta resident, then you have full coverage for medically necessary physician services. There is some dental, some oral surgical health services. But essentially, it's anything that you would need when you go to see a physician, any diagnostic tests, MRIs, blood tests, all those kinds of things are provincially covered for us. So if you kind of compare that to what is available, let's say if you were an American citizen, these kinds of things are not, these are pay-for-service kinds of things if you happen to live in the U.S. So that's the difference between having our Alberta Healthcare insurance plan. These things are provincially covered for us. We're not having to pay for these kinds of services and medical needs. We just, we just access them. This is what we pay for with our income taxes. So these are the services that are available to us. Does indicate that prescriptions are not provided. So medication or prescriptions, so when you go to see your doctor at a walk-in clinic or your regular general practitioner, when you go to see that doctor and they give you a prescription, those kinds of prescriptions are not covered. So medications that are provided when you're in the hospital, those are covered under Alberta Healthcare. But general prescriptions that you would get, say for an analgesic or maybe a birth control or a PPI, stomach remedy, those regular prescriptions are not a benefit through Alberta Healthcare. So there isn't any cost associated when you access, blood tests, x-rays, those kinds of things. These are provincially funded services that we can acquire. The other next three plans that we have, that I have listed here, so the drug benefit supplement. This is specifically for folks who qualify for benefits under the Alberta Human Services. So back to this chart here. So the folks that fall under this third-party agreement, these are the folks that can access the drug benefit supplement. And so what is available under there is there's some additional diabetic supplies. Oftentimes you'll see a lot of pediatric products. It can be antihistamines. Some nutritional supplements are available. Analgesics, again, most of the time there's age restrictions that you'll find in there. So restricted benefit based on a patient's particular age. There are some smoking cessation products in there with some lifetime maximum benefits provided there. So it's just kind of an additional benefit that supplements the IDBL. The IDBL supports our folks who, so any of these provincial plans are going to follow the Alberta Drug Benefit List, or the IDBL. So our Blue Cross Group 1 and seniors must follow the IDBL, or the information that's provided in the IDBL. Our human service folks have the IDBL as well as this additional supplement that they have access to. But again, some restrictions, age restrictions apply in that particular benefit listing. Then we have the insulin pump therapy program. This is specifically for folks who are insulin dependent. It's quite tiny in here. I tried to plug a lot of information in there. So obviously the patient has to be an Alberta resident. They have to be diagnosed with a type 1 type of diabetes, so that means insulin dependent. And then there's some other criteria that they must follow. So they have to see a dietitian, they have to attend some sessions, some kind of group sessions, annual appointments, they have to have their A1C monitored. So there's a lot of criteria that they must follow in order to qualify for the insulin pump therapy program. The one thing that I didn't include on here that I should have, as far as some examples of benefits. So I put a lot of examples in here. If you only had one, that's perfectly acceptable. I just wanted to have multiple in here so that you could see it was actually a benefit. For folks who are wishing to qualify for the insulin pump therapy program, typically their motivation is to qualify for an insulin pump itself. And the reason for that, insulin pumps are quite expensive. They can run about $7,500. So they really are very expensive, but if you are eligible under this particular plan, then this plan would actually pay for that insulin pump and then any of the supplies that you need to operate that insulin pump, which includes the infusion sets and the reservoirs that hold the insulin, and of course the glucose testing strips, ketone strips, anything you need to kind of manage your diabetes falls underneath this insulin pump program. So this is something you will see pretty often when you're in community practice as well. They don't have a lot of limits. I mean, they're quite generous when it comes to their limits. So I did populate, I just want to see if I can get, no, it won't let me copy and paste. So when you're looking at this document, I did post some links in here. So if you copy and paste this link into a web browser, this one will actually take you to a benefact that defines very clearly what those quantity limits are, but they are very, very generous when it comes to what they're allowing for patients who qualify for the insulin therapy program. The patients don't have any copay, so really it is a nice program for our insulin dependent folks if they are on an insulin pump or wishing to get an insulin pump. And then the last one that I'm just going to talk about quickly is the Palliative Benefit Program. So there is a searchable benefit list. I did post that link here as well. It's not letting me copy and paste it from kind of the platform I'm using at this minute. And so this is kind of a supplement for our folks that fall under these provincial plans. If they've been deemed to be palliative, so palliative typically means end of life, end stages of life, just kind of providing comfort measures for these folks who are in end of life situations, and some examples of things, fentanyl. So it's an analgesic. Sometimes due to their treatment, they have some trouble and are needing laxatives. Maybe they're not consuming enough food or water or hydration, and there's some hydration supplements there as well. So this program supplements these additional programs. Sorry, my mouse isn't working the way I want it to. Supports these additional programs here as well. But someone certainly could be covered through RCMP, although if they're RCMP, they're probably not active, which means they would have moved down to Veteran Affairs. So it's likely that they could have Veteran Affairs and then qualify for the palliative program as well. The pricing policy is the same as it is for any of our provincially funded programs, and there is no copayment. So once someone is deemed eligible to receive these palliative benefit program products, they would get those products following the pricing policy that is listed, but there is no copay for those particular patients. So again, these two documents, so between the third-party comparison chart as well as these other provincial health benefits, this chart you will use less so when it comes to dispensing and so on and so forth, but as you move out into practice, this is beneficial information to be aware of depending on where it is that you practice. Maybe you practice in a community pharmacy where maybe there is a clinic, an approved pump supply clinic very close by, then you might see a lot of these patients coming through. Maybe your clinic is next to, or your pharmacy is next to a cancer clinic, so you might see, a substantial amount of these kinds of patients. So the other provincial benefits chart used less so, the one that you're really going to want to take forward with you and kind of put into your memory is going to be this third-party comparison chart. So I'm going to leave it at that because I don't want this video to get in excess of 15 minutes as well. So that is my summary information for both of the charts.